Welcome to Board Certified, expert interview episodes about medical licensing exams and healthcare careers. I'm Tyler, founder of Achievable, and we offer affordable adaptive online prep courses for the USMLE Step 1, MCAT, PTCE, NPTE, and others. Each course contains everything you need to succeed, including comprehensive study guides, video lessons, thousands of practice questions powered by our memory enhancing algorithm, and full length practice exams. You can get a free trial of any course by going to achievable.me. And if you like it, be sure to use the code podcast to save 10%. Now, let's get started. Today we've got Sharon Denise Garrett, CPhT, with us. Sharon, I'd love if you could introduce yourself.
Hi, everyone. My name is Sharon Denise Garrett. I am a certified pharmacy technician with 17 years of experience, with the past 5 years being on the academia 340B side of pharmacy.
Yeah, fantastic. So today we're going to be talking about the two big pharmacy tests. There's the PTCE and the ExCPT. So let's first just set the groundwork for this, right? Why do you need to get tested in a pharmacy technician career, right? Besides that, they don't want you to go stealing a bunch of drugs for yourself. But what is the importance of these tests?
So, mostly the importance is basically liability, what you said, and then also education, making sure that we have the correct people in those positions that know what needs to be done for our patients. It's just like with any job, everyone can't be a doctor, everyone can't be a nurse. So, just making sure that you are knowledgeable in the concepts of pharmacy is the reason why you should become certified.
Yeah, great. And then let's talk about these two tests. It's a little funny, like you could call it like the ACT and the SAT, but they're each run by different governing bodies
Mm-hmm.
and they compete with each other, but usually most states will take both scores from either one.
Mm-hmm.
So let's start with what do you feel like the key differences are between these two tests?
And it was like I'm gonna hate saying this, but it is known to be true. So the NHA ExCPT exam is more of a retail based exam. They don't ask a lot of the sterile compounding questions that PTCB will ask. So if you have a background in retail pharmacy or you took a retail pharmacy on the job training type of course, then that test may align more with on the job experience that you have, as where PTCB is more of a if you went to a proprietary school, a community college, or any of the ASHP accredited programs that most state boards of pharmacy require you to take. PTCB will be the more comprehensive exam. PTCB is more widely known and most preferred. So I always tell my students, you could take NHA, the ExCPT if you want, but when you're interviewing and if you have the EX and someone took PTCB and they prefer PTCB, then you may be overlooked for a job. So there's that. I also have technicians that they do take the ExCPT exam and then they might study up to take PTCB. So I do know several technicians that has taken the lower exam and then studied more to be able to pass PTCB.
Yeah, so I'm curious about that because when you look online, it looks like the two tests are basically equivalent, right? And I think they have different weightings, but they cover
Mm-hmm.
almost all of the same general broad topics. And so I'm curious, like, what is it that makes the PTCE a little bit harder, or like you have to study up for it? Does it cover more stuff that the XCPD doesn't cover?
I would say they don't ask many general questions that you would primarily deal with in a retail setting. So again, the knowledge-based concepts of pharmacy. One exam is okay, what is this medication? As where the other one's like, what is the mechanism of actions of this medication? So with the PTCE exam is more details, whereas okay, where does this medication go? How does this affect the body? Or sterile compound, what is ISO? What is ISMP? What is REMS? What is it? Asks you more detailed questions. It asks the just the why is the who, what, when, where, why, as the word. This may be like, oh, what is this? As the word, not like the other exam is asking more detailed questions. So for someone that's in a retail setting, you may just like, oh, okay, I know this medication is for an acid reflux, as whereas, okay, I know the mechanism of action on this medication is the respiratory system, and you have to do this, and it goes through the liver and it goes through the blood. And it's like, just having to know that extra details makes PTCB a more advanced exam in the eyes of those that prefer it.
Yeah, and I guess that is like another important thing, right? Is you feel like people are going to select people that have a PTCE for a job if they're equivalent in all the other ways. Like, why is that?
So again, it just has to do with knowing the details of. But me personally, I feel
Mm.
like if I had two technicians and we are in need of technicians, I'm going to hire whoever is certified. Like as long as you have your state certification, whoever is able to work is who's going to work. But sometimes a lot of organizations look at it again for liability, where if this person only has a retail background, then they may not understand the importance of the difference between fluconazole and fluticasone. So just minor things like that. It's just the specialty is in the details. As to where in a retail setting, you may look and see, oh, okay, this drug is spelled different from this drug, and just go ahead on. As to where on the other exam is like, no, this is tall man lettering. This is why we use tall man lettering to make sure that you're picking the correct drug, or routes of administrations, or being able to have that more encompassed math where it's, oh, you might be in a retail setting, oh, we just don't have this and we just don't have it. As to where another exam is, hey, you don't have this medication, but this is the medication that you have. So use the math to be able to convert this to use a different medication. So again, one exam is more so like on the job, just get it done. These is the questions that these are the problems or issues you mostly run into, as to where the other exam is kind of more like a critical thinking of exam. Okay, how do we solve this problem as a technician?
So why do you feel like that critical thinking becomes more important in a hospital setting?
Because we're dealing with critical patients. And we have a limited ability of time. Some medication that we may stats, like in a retail setting, we don't have stat medications. We just have waiters where they're like, oh, this is 30-day supply of medication. Sometimes we have medications that we have to make, we need emergent immediately right now today, or being able to tell the difference between micrograms, milligrams, grams, and kilograms. So on the retail side, we just deal with milligrams and micrograms, as where on the hospital side now we're dealing with grams. So again, one exam offers you the ability to pass the exam, the national exam, and become certified with limited information, or the information that you will learn on the job. As to where the other exam is, okay, let's expound on this, let's expand on this. Why do we learn this? What are we learning this for?
So would you say that's like the main difference is that really what the XCPT maybe is a little easier, but it also gets you in the door faster, and that's the advantage of it.
Absolutely. And for my students that are nervous to take the PTCB and they are running up against a deadline, saying they're like, here in Louisiana, their candidacy license is good for 2 years. So let's say I have a technician and they took PTCB twice and they failed. And now they're nervous and they're like, my license is about to expire. I'm about to lose my job. I need this income. What should I do? Take the other exam just to pass so you can keep your job flowing and that money flowing into your household, and then study up to pass PTCB. Because I think NHA, there's a 30-day wait period for between each exam, and then up until probably like your third time felon, you have to wait for 6 months. um that's not the same thing with PTCB. PTCB is if you fail it once, you wait 2 weeks and you could take it again. And if you fail it a second time, I believe at the second time, you have to wait 6 months before you could take it a third time. So just the intimidation of the test will have someone like, oh, I don't want to ever take this test again. I don't want to ever take the test again. And then, especially as soon as you take the test, you know right then and there, pass or fail. As to where with the ExCPT is, they make you wait 24 hours, pass or fail, it does not matter. And then they're scored differently. So the ExCPT is 390 to 500, as where PTCB is 1400 to 1600. So I figured out like how much each one is. You have to get right to get a barely a 1400, and it's 72 questions. So you have to get 72 questions right. For PTCB, there's 90 questions. 80 of them have a score. You have to get 72 of them correct to be able to get a 1400, or just score really, really
Yeah.
high in the medication section, because that's 40% of your exam. Just knowing that, as where the ExCPT, there's 120 questions, 100 of them have a score. So you can get, I think it's 85 questions correct to get a passing score for 390. But I've had students, like I had one student for when I was teaching at Unitech, she had 1393. So she had 1393. So she literally was like 7 points off. So I was like, oh, that's literally like two questions. And she's like, oh, I went back and changed the answer. And I was like, no, do not go back and change answers unless you absolutely know like your new answer is the best choice. So things like that,
Right.
like the score and the ranges is very important when it comes to these exams.
Yeah, exactly. And then I'm curious with them being a scored test, and it's not just like a pass fail. It is pass fail, but it's also like you can have a better pass, right?
Hmm.
Does that ever come into play with pharmacy technician jobs? If you have a 1550, does anyone
No,
care or not really?
no.
Okay.
I get the formality of the score. It just lets you know, hey, you really know your stuff. But no, a pass is a pass. So that just means your score just means this particular information that we're asking you, this information. But I've seen people with very good scores get in the workplace and I wouldn't sign my name on nothing with them. And it's just the material that they studied that they knew. But sometimes real world experiences advance you further. This is why I don't look differently at the ExCPT exam because they have that working experience that someone that was set in a program for 6 9 months 2 years may not have, or they only got on that externship as where this person been on a job working for 5 years. They have that learned experience. So this is why I enjoy working with organizations that prefer PTCB, but they're accepting both because hey, you might took the lesser exam, but you have that real world working experience that can help you advance even though you didn't take PTCB.
Yeah. One of the things that I noticed when looking at this is that like the PTCB can give you other things that are still pharmacy technician related, like a advanced certified pharmacy technician
Mhm.
or a immunization administration certificate or the certified compounded sterile preparation technician certificate. Whereas I don't think the XCPT has follow-ups that are quite so directly related. Is that
So
correct?
they don't. I know for certain that they have aligned with other organizations, so such as NPTA or BPTS, which is ran by Mike Johnston. I know NHA aligned themselves with that to where if their technicians want to get additional certifications, such as medication therapy management, narcotic technicians, chemos, or any other specialties that you mentioned, they can go and use their certification for that to align them. But when I took PTCB back in 2013, all of that was just one job. So I'm kind of like grandfathered in on all of those tasks. Now, if a job asks me to get the extra certifications, being a PTCB certified technician, then I ask two questions. I'm gonna say, hey, are you reimbursing me for taking this exam? And once I pass this exam, does this guarantee me more money? So I always tell my technicians if the certification is not going to be reimbursed and they're also not going to give you any more money to learn that skill, if you can get it in-house where you may be certified at this one particular organization, use that to leverage your career. But if you don't have to get the extra certifications, or if you just have the dispensable funds to be able to take the certifications, but with PTCB, once you become a PTCB certified technician, you can't take any other certifications but the ones PTCB offered. So I couldn't take any MPTA certifications and present it to PTCB because I only can take what I'm certified to.
Yeah.
Yeah.
Fantastic. Was there anything else that in this sort of debate here that we haven't covered that you want to make sure we talk about?
Just to let people know that there are two exams. I know a lot of people do not know that there are two exams, but regardless of what exam that you take, make sure your state board of pharmacy is okay with you taking that exam. I know PTCB is the more nationally preferred exam, but for those that do take the NHA exam, make sure you check with your state board of pharmacy to see if they accept the EXCPT exam. I know here in Louisiana, we just started accepting it in 2018, and I know that's crazy to say because the organization been around since 1994. And pharmacy technicians been around since 1990. So that's crazy. They just recently started accepting this not even 5 6 years ago. So just make sure whatever exam that you take, check with your board of pharmacy to see can you be a certified technician with that national exam. Make sure that you keep your exam active That's another important thing, especially for us coastal states, because if we have a hurricane and I have to evacuate, I can evacuate anywhere and still work as a technician as long as my national license is active. And then make sure that you are doing your continuation education credits. So making sure that you're always on top of the newest and the latest things going on in pharmacy. And from that, you have a very well-rounded career.
Fantastic. Thank you so much. This has been Board Certified, hosted by Tyler from Achievable with Sharon Denise Garrett, CPhT. And Achievable has great online courses for the PTCE and ExCPT exams. You can try them out for free by going to achievable.me.